of care implies that the resident should take care of the patient in a way and manner a resident of his standing should take care of that. Now, when you prove duty of care, you prove breach of that duty. Meaning that firstly, you need to establish, as a claimant, you need to establish there is a duty of care. You need to establish that this duty of care has been breached. You need to establish that you suffered harm. Then you need to establish that there was causation, that the harm you suffered is linked to the breach of the duty of care. That because duty of care was breached, that's why you suffered harm. So these are the four ingredients a patient who wants to sue, file an action for medical negligence must prove. Coincidentally, it is the same action, is the same thing, an extra that he needs to prove for medical malpractice. Now, what is medical malpractice? Medical malpractice is the willful, very important, willful deviation from standards of medical practice in course of treating a patient. Willful deviation. Now, last week we discussed ethics, and one of the pillars of medical ethics is the principle of beneficence and the principle of non-malfeasance. Non-malfeasance says do no harm. As a healthcare professional, you will not, you should not, you cannot willfully do harm to your patient. And it is one of the undertakings. So, where you now find a healthcare professional involved in organ harvesting or organ trafficking, that is medical malpractice. It is not a mistake. It is a criminal act. Where a patient comes for surgery and unknown to the patient, the healthcare professional also harvests one of the kidneys of the patient. There was an incident in Plateau State where a woman's kidney was stolen without her knowledge. It was when she visited a second hospital or something like that she got to know. In 2014, I was supposed to handle a case where a woman's womb was removed without her knowledge. And in the course of suturing, they ruptured the woman's bladder. She was beginning to have incontinence, leaking of urine, urinary incontinence. And when she now went to correct that, that's how it was discovered that the womb was not there. So these are clear cases of medical malpractice. It is not negligence. So I need you to draw that dividing line. Now, most of medical malpractice cases will end up in police station because they are oftentimes criminal in nature. Where somebody wants to procure an abortion and the doctor engages in unauthorized abortion leading to the death of the patient, it is medical negligence and medical malpractice. Why? Firstly, abortion is criminalized in Nigeria, except where it is to save the life of the mother. So where that such an unauthorized abortion is embarked on and the patient, it is a criminal offense. It is medical malpractice, not medical negligence. Now, medical negligence example is wrong dosage. You are giving the right medication, but a wrong dosage. Let's say you are supposed to administer 3 milligram, 3 millimeter of that medication, and you administered 5. Let's say you are supposed to administer 2 tablets, you administered 1, or you administered 3. These are errors. So you have the wrong medication, but the wrong dosage. You have the right medication, but the wrong dosage. That's malpractice. That's negligence. Now, if we are talking medication administration, there are different minimum of 6 rights So if you omit one of those rights, it is negligence. Now you want to administer a medication, we look at the right patient. That is one. Is it the right patient that I'm administering this medication? Firstly, is it the right medication? One. Two, is it the right patient? Three, is it the right dosage of that medication? Four, is it the right route? Is it supposed to be through intravenous injection, or should it be through ingestion? Get it? Is it through injection or through ingestion? You swallow it. So we've talked about right patient, we've talked about right medication, we've talked about right dosage. We are talking about right routes. So which route? Is it supposed to be tablets? Assuming it is injection, are you supposed to give it at the buttocks? Are you supposed to give it through the vein on his hand? Are you supposed to even inject it inside a drip infusion? That's right route. Then, we look at right time. Is it morning, afternoon, or evening, or night? Then we look at right documentation. So now, any mistake that occurs here is negligence, not malpractice. Example, there was a case in Japan. A woman went to procure abortion. Another woman came for antenatal care. And mistakenly, they conducted abortion on the woman that came for antenatal care and not the one that came for abortion. So that is negligence, wrong patient identification. What they would have just done was maybe use a ribbon, blue ribbon for people who came for abortion, red ribbon for people who, or vice versa, red ribbon for people who came for antenatal care. You just identify your patients. They missed it. So it's negligence, not malpractice. Now, where a patient, where a healthcare professional is supposed to give injection in the morning and you forgot, maybe the person had done nights and is supposed to go and rest, but because he's traveling tomorrow, he agrees to do morning for a colleague. This morning, so that that colleague will now do night and she will now use the night to travel. So she's now on duty and that injection in the morning or medication in the morning and comes back to administer it in the afternoon. That is negligence. So it is punishable. There is liability. But most times, negligence is not criminal in nature. But where it leads to harm, which sometimes it could, because we are dealing with life here. So where it leads to harm, let's assume the person gives a wrong dosage. Now, there are some medications that sound alike, but they are different. But their names are closer. Now, you want to prescribe medication A and you prescribe B, that is an error. So I just needed us to get the difference between medical negligence and medical malpractice. Now, you did an excellent job in the issue of the cases you cited. There are two cases here that interest me. Prof, the case of the University of Benin, Uniben Teaching Hospital. That particular case, the man that was dismissed was a professor of medicine. I followed that case seriously. I followed that case. Elusoji, the medical doctor that was dismissed was not just any type of medical doctor. but a professor of medicine. Then let me shock you. For Dr. Oji's case, as I'm talking to you right now, he is serving 1 year jail term. In fact, that's his own case. He was convicted with his wife, but the wife paid fine or was granted leniency. So that's why she's out. But the man is serving jail term. Apart from this case, this particular case, there's another case against him that is pending before the Supreme Court at the moment. OT against the SL Medical Center, Lagos. Because that SL Medical Center is owned by Dr. Oji, this same Dr. Oji. So that is how serious issues of medical malpractice or negligence can be. Now, what are the examples of negligence? Where you fail to turn, okay, let's go to section 28 of the Medical and Dental Practitioners, Code of Medical Ethics. Section 28 of Code of Medical Ethics itemizes what, from the professional standpoint of healthcare personnel, what they consider to be negligence. And it will interest you to know. One is failure to see the patient as often as the patient's case requires. That becomes a negligent conduct. Another is failure to do all that is necessary in the circumstance of the patient's case. That becomes a negligent conduct. Misdiagnosis, which you mentioned, is negligence. Then, issue of writing prescription, illegible prescription, where doctors will write and you will be unable to read the writing, but when it is time to write their bill, you read the writing. So that their writing has sent so many patients to the great beyond, because when they write, and some of these patent medicine store owners who are not trained pharmacists, they cannot decode what the doctor has written. They will just look at it, and think of anything, just go to the shelf, carry medication and give. So doctors are encouraged to write what the patient will be able to read and understand. Even though the instruction or the prescription is meant for the pharmacist, who is supposed to read and understand, because it is written, maybe sometimes the chemical composition of the medication is what they write. So those are a few examples of negligence. Failure to turn maybe a patient as often as the case requires is negligence. But I have mentioned, okay, there have been cases, some fatal cases of negligence, where a doctor is supposed to operate on the left ear, and the doctor ends up operating on the right ear. That is also issue of negligence. So your paper is very, very detailed, and the depth of the research, particularly, I am thrilled with the live cases. Now, for what's it called? For healthcare fraud, there is a case in Makurdi. In Benue State. I'm going to post that case on the platform. I have requested for the Court of Appeal decision. Now, in that case, a man took his son, 2 years old child or 3 years, to the hospital, and the hospital made some prescriptions to get consumables. One of the items written, the hospital did not have it, and the cost was 2,500 naira. So the man, the father of the child, went out of the hospital to buy that medication or the consumable. Now, when his bill came, the hospital included that 2,500 naira in his bill. And the man said, no, the hospital didn't have this. I bought it from outside the hospital. And the hospital insisted that the man will pay. The man said, okay, release my baby to me. I will come back and pay. And the hospital detained the child for hours because of 2,500 naira. So the man sued. And the court of first instance, the High Court of Benue State, agreed with the hospital that the hospital was right in detaining the child. And the man went on appeal. The Court of Appeal reversed that decision and slammed the hospital with a fine of 250,000 naira and a refund of that 2,500 naira to the man. So you can see one of the ways hospitals engage in healthcare fraud is charging and insisting on patients paying for services that were not rendered. Charging and insisting that patients should pay for services that were not rendered. Another one is where, under we will soon do patients' rights. One of the rights of a patient is right to transparent billing. Now, what is transparent billing? Transparent billing or open billing is where, as the patient is getting treated, for each treatment, the patient is told the cost. For each healthcare consumable that is purchased, the patient is told the cost. So this injection and syringe and needle is 500 naira, or the injection is 1,000, the syringe is 700, the needle is 200. The patient knows. The surgery you underwent is this network is becoming unstable again. The surgery you underwent is 10,000. You add it. As the patient is getting treatment, the patient is having all the bills together. So when at the end of the day you tell the patient your bill is 374,800 naira, the patient will not be alarmed as to how and why this bill accumulated to this point, because the patient was carried along. But where the patient, they lump all the bills together and they just tell the patient, your bill is 500,000. The patient does not have a breakdown of how the money arrived to 500,000. It is also one of the ways of through which hospitals perpetuate fraud against patients. And the impact of healthcare fraud cannot be quantified. The impact is not just it doesn't just have a direct impact on the patient alone. It paints our hospital in bad lights. On the 27th to 30th of August, I was a speaker at one medical tourism conference, and we are trying to promote inbound tourism where people will come in. So if we keep practicing healthcare fraud, you will discover that it's going to give a bad image, a bad name to our hospitals in Nigeria. That people outside who want to come to Nigeria for treatment will, no, don't go there, they will defraud you. Don't go there, their system of billing is crazy. So you see that healthcare fraud is not to be encouraged, but what are the causes? But we look at
Hello, sir. Can you hear us? Hello, Mr. Ebenezer. Are you with us?
both sides. What are the, apart from
Sorry once again. About the network. Mr. Ebenezer will be joining us shortly. Sorry once again.
I'm back. Sorry about the network fluctuation. So every day we talk about corruption, and we think it is only the politicians that are corrupt, or we think it is only the that are corrupt. But no, I used to tell this class every time we treat this topic. I have a friend whose friend, he's my friend, and his own other friend, whom I don't know, a medical doctor, was working in a hospital. And this young doctor was doing his best to attend to patients when they come. If there is no need for admission, he will prescribe medication. Some he will say, just go home and rest. Some he will say, exercise. Some he will say, take fruits. But he was not admitting patients needlessly. So the owner of the hospital, the woman that employed him, now say, doctor, if you continue like this, we will not have money to pay you at the end of the month. So when patients come, you have to admit them, give them bed. Whether they deserve it or not, just give them bed. That way, they will pay more. And from the more money they have paid, we will see money to pay your salary at the end of the month. Of course, the young doctor resigned because that was practically against his principles. But that is healthcare fraud, where nurses or health, not just nurses, where healthcare proprietors, if I may put it that way, defraud patients by inflating the services rendered, by even charging for services not rendered, by treating non-existent ailments. Then there are cases to where healthcare professionals collide with patients to defraud. You pay your insurance, health insurance to them, they attach you to a hospital, and you now see a situation where you have not made a claim, you have not been sick, but they will go and connive with the hospital pretending to be sick and have received care. Then the insurance, the hospital makes a claim on the insurance, and the insurance parts with money. It is also healthcare fraud. So there are means and ways, even Purchase of substandard health consumables. This one is worse because money is voted or allotted or designated or approved for a particular quality of either healthcare equipment or healthcare consumables for surgery. Then the procurement officer goes to procure substandard of those equipments and pocket the remaining money. Or for stocking of the pharmacy of the hospital, the person in charge of suppliers connive and supply less than what has been paid for. It is also fraud. Any way or manner through which the money that is voted or designated for a particular purpose is reduced for the enrichment of the private pockets of those in charge within the hospital sector. That is healthcare fraud. Now, the impact, it has direct impact on the patient. One, either financially in his pocket, two, in his health, where substandard medication is used in treating patients. You can see the ripple effects, negative effects on the health of the patients. So what can
We apologize again. We apologize again for the network challenges that we experienced in class. We hope as we move on with the program, we will not get to experience this occurrence happening more and more. All right. So please, once again, we would like to ask for your patience and for you to bear with us. All right. We'll try to see if we can get Mr. Ebenezer back again on the call to finish his sessions. Then we'll take questions, we'll take pictures, and then we'll call it a day. Hello, Mr. Ebenezer. Can you hear us? I can see you're back on the call, sir. Hello, Mr. Ebenezer. Are you with us?
curb healthcare fraud? One, some patients even were fraud. Yes, I can hear you. I want to clear hand up. It's trying to rain here, so that's why the internet is being unstable. The cloud has been gathering since. So, can you hear me?
Yes, sir. We can hear
Can
you, sir.
anyone hear me?
Yes, sir.
Okay, I
Yes,
say
sir.
quickly, how do we curb health? Speak out. You're right. for your rights. The cite of that baby did not demand her right. We will not have the judicial pronouncement we have today, where the Court of Appeal has established firmly that hospitals should not charge for services not rendered. Another healthcare fraud that is prominent is issue of blood transfusion, where the patient has paid for blood, and maybe the patient has paid for 3-4 pints of blood and only 2 were used. What happens to the other 2? The hospital rarely refunds the money to the patient. My personal advice has always been the hospital can take a percentage of that money paid, maybe for treatment and screening or storage preservation of the blood, and refund the patient. So assuming a pint of blood is sold for 20,000 naira, if that pint of blood was not used, the hospital should refund the patient 15 or 12,500. Should refund the patient, yes. The hospital should take 5,000 for treatment and screening, or the hospital should take 7,500. Refund the patient the other money because that blood was not used. So, in conclusion, healthcare fraud happens, is rife not only in Nigeria, it is a global menace and is condemnable. Now, you as a patient's rights or medical lawyer or health lawyer in training, you need to know that you can take it up. In 2022, I did a case. It was insurance. My client had the subscription or premium of my client covered a particular surgery. But when the surgery came up, the insurance company said that it didn't cover. So my client went ahead and was paying out of pocket, flew from Abuja to Lagos, hotel, everything. And when the case got to me, I simply wrote to the insurance company for us to review the health package of my clients. And when the insurance company got to see that they had been caught, they had no choice but to refund my clients out of pocket expenses made. So health fraud is condemnable, but it is not intractable. It can be arrested by what? Sensitization to seeking for redress where healthcare fraud has happened. Put your feet down. Don't say it is 200 naira. Don't say it is just 1,000. So if you calculate 1,000 naira times 100, that is money. So if they do it to 3,000 patients in a span of 6 months, that is money. So it is not about how much that is involved. It is about the practice itself that should not happen in the first place. So thank you very much. Let's quickly take our group photograph, then we take questions before this network misbehaves again. Or have you taken the photograph, Dennis?
Not yet, sir. We'll be doing that right now.
Hello?
So please, we would like to quickly take our pictures. Kindly turn on your video so that we can do that quickly.
Hello, Dennis. Can you hear me?
Yes, sir, I can hear you, sir.
So everyone, please turn on your camera. Today we have taken 3 introductions. We took Joy, we took Blossom, and I think Ayo, right? The third person.
Yeah, so we are done with pictures, sir. We are done with pictures. Thank you. We'll be taking questions. If you have any questions you would like to ask, please go ahead and ask your question now. Hello, do we have questions?
Hello? The rain is
Yes,
coming
sir, we can hear.
serious. If you listen, questions.
Mary, are you trying to ask a question?
No, I'm not.
Oh,
Okay,
all right.
so can I ask my own question? Okay, before I do, have you taken the pictures?
Yes, I have.
On Thursday, okay. On Wednesday, the 17th of September, is World Patient Safety Day. You are in a medical law class, so you should begin to know the different days. The UN has a mark for different things, not just put interest the day they are doing cancer. Cancer is usually in October, for breast cancer specifically, but cancer generally is February, first Saturday in February. Then for this month, there is World Patient Safety Day on Wednesday, 17th. On Thursday and Friday, I am holding a webinar for the MBA, Gariki branch, is understanding patients' rights and medical and legal remedies in Nigeria. So I will put the link and the flyer on the platform. Join, because that's going to be 4 hours, 2 hours on Thursday. That is your patient's rights lecture. So tune in, because in our class here, we will not have that topic. So join that webinar on Wednesday, on Thursday and Friday. I'll post the flyer and the link. On Thursday, it is 3 p.m. to 5 p.m. On Friday, it is 10 a.m. to 12 noon. I am aware some of you might be attending lectures, some of you might be engaged in other academic activities, but if you have the time, join. Some things I will say there, I may not. So begin now to pick interest in different web capacity building, because what you are getting here from JIIPCC is just 6 weeks. If you really want to practice, I am pained, or I feel bad that you people missed out on the career opportunities webinar, because I was trying to post on the platform and the platform was the setting was admin only. So begin to build your capacity. Once you see webinar, register, participate. If there are some you can part with little money, part.
Okay. Mr. Ebenezer is out again. His network has been very bad. I think it's partly because of the season. Rain has been falling quite well, and it's also falling over here where I am. So, sincere apologies once again. So not to waste our time, right? If at all he gets to join us, then he will just round up with everything that he's saying, even though he's done officially with his lectures. But just to give us a reminder, the pattern in which we have taken to address class is the same pattern we'll be taking moving forward. Right, we'll be having presentations first before we have his discourse. And if there's any need for other introductions, it will be done in class. So please let's make sure to always be available on time for class, so that if at all you are to participate in presentations, right, you can kindly be on time to do that, right? So this is just an encouragement. Please do not forget that questions are a very important part of our sessions, right? So please, in class, while you are coming, please make sure to prepare your questions from your research that you have made, right? So that you can ask questions during sections. They are part of the medium in which we try to encourage learning within the program. So please and please, let's try to make questions. Hello. Okay, let's try to make questions a core part of, classes. So please, let's not fail to ask questions in class. All right. The attendance will be sent out to the group immediately after class. Do not forget to fill in your attendance once. Do not forget to fill in your attendance when it is sent out to you. All right. The group or the new task for the week will be sent to the group either today or very early in the morning tomorrow. All right. So please let's watch out for that and try to get to work as soon as possible. Thank you all for your patience in class. Thank you all for following through, even when we had to restart the session. Right. We look forward to seeing you all next week, same time next week, 4 p.m. All right. Thank you all, and please enjoy the rest of your Sunday. Goodbye, everyone, and enjoy your Sunday once again.